has become now our new normal is taking a hard toll on some families. Joining us live from Hartford Healthcare Studios is Patricia Rehmer. She is the Senior Vice President with Hartford Healthcare and President of their Behavioral Health Network. Thank you for joining us today.
Thank you for having me.
So Mayor Bronin of Hartford just announced a new team to focus on domestic violence calls. They're up by 20% during this pandemic. Talk about the risk of abuse during this time of isolation.
Sure. I think isolation can lead to a number of different things for different people, but obviously from this report, we now understand that it also can increase domestic violence between partners. I think the issue is that we have people that are isolated at home. They may be out of work, spending more time together than they're used to, with the additional stress of worrying about whether they're going to get sick or their loved ones are going to get sick. It does put people at risk for increased violence.
Oh, it's tough. Talk about how one can avoid or prevent the escalation of emotions from turning into abuse, that turning point.
Right. I think it's really important that people who have been the victims of domestic violence in the past really make sure they have a plan at this time. And then for others who may be experiencing it for the first time, I think there's a couple of things. One is, if you see that the tension is building in the house, find a way to get out. Go for a walk. Take the children out for a short period of time. Try and find some time to be alone and apart from each other if you can, even in the same house. Being together like this is very different for many couples, and it's a long time to be isolated together. So it's important to try to remember to give each other some space.
And let's talk about how this social isolation, we're going on 4 weeks now, can wear on anybody, but especially those in treatment or with mental health issues. What is Hartford Healthcare Behavioral Health Network doing to help the most vulnerable?
So I think that we are trying to keep all of our services open here at Hartford Healthcare and in our Behavioral Health Network, so that if people need assistance or are in treatment with us, we are seeing them via telepsych or even just telephonically if they don't have the equipment for telepsychiatry. I think it's critical. We have opened up a warm line, and I want to emphasize that this is a warm line. This is being staffed by people in recovery themselves. And it's for people that want to call and potentially just have a brief conversation with somebody about maybe the anxiety that they're experiencing or what the isolation is doing to them.
Very good. What is the best way we can process the information we're hearing related to the number of deaths as the death toll rises? People are fearful, and no one can really predict when it will end.
That's right. It is very difficult to predict, and everybody is struggling with that. And I think processing the information is really important. I also think that people need to get time away from the news and turn off the TV from time to time to give themselves some space. There's so much information out there, and it's changing drastically every day. And so there is a need to keep up with the new information, but there's also a need to step away from the TV at this point.
Okay, Patricia Rehmer, thank you very much for your insight. We appreciate you being with us today.
Thank you.
Thank you. Teresa.